So I'm going to give an overview of the Age and Dementia-Friendly planning efforts, and with a real focus on housing today. We also have Morgan here from Community Development to talk about the various loan programs that are available in town for home modification. And then we're going to spend the last half hour just getting feedback from all of you on housing in West Springfield. And then we'll come up with some priority issues and vote on those. So, what do we mean when we say age-friendly community? Does anyone want to give a definition?
Community that supports all ages, whether it's in the cradle or 2 steps before the end.
Yeah. The World Health Organization definition says an inclusive and accessible community that optimizes opportunities for health, participation, and security so that the quality of life and dignity are ensured as people age. Or it's a great place to grow up and grow old from ages 8 through 80. So yeah, it's really, if you make a community that's accessible and livable for older people, it's also going to be great for younger people as well. These are the 8 domains of an age-friendly community. It's a diagram that the World Health Organization came up with. There's basically 3 types: the built environment, which can be outdoor spaces and buildings, transportation, and housing. Transportation can also sort of fall under services because you have the public transportation and vans provided by the senior center. Then we have social participation, respect and social inclusion, and civic participation and employment. And then the last 2 are community support and health services, and communication and information. And communication really spans all of these sectors, just in that, how do people get information about the services and programs that are available, and how do people sort of get together. And then a dementia-friendly community is a community that's informed, safe, and respectful to foster quality of life for those living with dementia and their care partners. The Dementia-Friendly America has come up with 10 sectors for a dementia-friendly city. The first, transportation, housing, and public spaces, infrastructure for people living with dementia. So do you have housing types that really serve people with Alzheimer's or dementia? And transportation might be signage, might be walkways, and public spaces that are have clear signs and not too much information there. Then we have businesses, legal and advanced planning services, banks and financial services, neighbors and community members, and independent living. And really all of these sectors, it's really, is there an awareness of how to recognize people with dementia? Are there, things you can do for caregivers to make things better for them and employment in their workplace? And then, are there memory loss supports and services available for people with dementia and their caregivers? And the town does have a dementia training coming up on October 18th.
For the department heads.
For department heads, okay. And just so that people in the town will know how to recognize it. So why plan for an aging population? It's estimated by 2035, the number of adults over 65 will outnumber children under 18. So that really has an effect on every part of our society. The workforce, the housing situation, transportation, all the other needs that older adults have. In 2019, we're building on the age and dementia-friendly planning efforts that West Springfield has done since 2016, when they became designated as an age-friendly community. So with a grant from AARP and also through the Mass in Motion program, PVPC is helping with these listening sessions and will help with the final report. And we're tabulating information from the Livable Communities survey that's been out for a few months. We're also going to be doing some stakeholder interviews, just trying to get into neighborhoods that, like with the refugee population and others that serve folks in the community that don't typically show up to these listening sessions, get an idea of what their needs are as well. And then we hope to complete the draft plan by November and have a plan out by January. I put at the bottom, PVPC is also working on hazard mitigation planning and municipal vulnerability preparedness. That kind of comes in with emergency management planning for Dementia-Friendly, and also, what do you do with people who are homebound, and how do you communicate in an emergency. So this is the third of 7 listening sessions. There's a few more coming up with specific focus. We had 2 general ones. And we're hoping to get people out at each of them to really focus in on the different domains. So for housing, the AARP survey consistently shows that people want to live independently in their own homes. So what does that mean? Do you have to modify your home? Do you have services available to help you get around if you can't drive anymore? Where is your home located? Is it close to places you can walk to? And are there sidewalks and lighting so that you can still get around if you're staying at your home? This is the results of the West Springfield survey, and in fact most people did say it's extremely important or very important to be able to live independently in their own homes as they age. So when we're talking about housing, we want to look at a range of housing options that are affordable, so smaller or shared units, possibly accessory apartments, which are apartments either attached to or within the home you're living in. Home sharing is another possibility that's come up in some communities, renting out a room. Housing has to be accessible, so on the first floor or have elevator access or wheelchair access. And then home modification programs to help you put in those accessibility measures. Also assisted living and long-term care options. So we have someone here to talk about the new one that's coming in. And location. So is housing located near retail, services and parks, places where you can walk to or roll in wheelchairs that are safe? Because as people grow older, there's more and more barriers that come up as you try to get around. So West Springfield has a home modification program, and Morgan's going to talk about that in a little bit. Also, there was a housing production plan that was developed in 2018. Was anyone a part of that process? Me too. Okay. So what that allows for is there's a requirement in Massachusetts that every community has to have 10% affordable housing, or housing that's affordable to people with 80%, up to 80% of the median family income. And if not, then a developer can come in who's has a portion of their development as affordable housing, and they can bypass the local zoning in order to build a property. The housing production plan, if it's adopted, allows the community to still have a say with the zoning, so they can avoid having to issue the comprehensive plans. And I don't think I don't think the housing production plan has been adopted yet.
No?
So some of the findings from the housing and production plan are that of the 12,600 units that are in West Springfield, 429 are affordable to people with 80% or less medium income. So that's 3.4%. So there's quite a way to go before you reach the 10% level. 34% of households spend more than 30% of their income on housing. So that's considered cost burdened. And from the Healthy Aging Community Profile data that the Massachusetts Coalition on Healthy Aging, 20.2% of people over 65 spend more than 35% of their income on housing. And that's for people that own their own homes. And then 13.4% of people who rent their homes spend more than 35%. So of the 429 units, 58% are for seniors, and there's right now a 2 to 4 year waiting list. And 13.2% of the community has disabilities. That's not just ambulatory or mobility limited, so that's all disabilities. But right now the Housing Authority only provides 12 units for people who use wheelchairs. This is just a part of a survey that was done for the housing production plan, and asked people what they thought of what housing was available and what they thought was needed. So 52% thought there needed to be more assisted living facilities for seniors and people with disabilities. And then 63% thought more single-family starter homes of less than $250,000. And then it's really a mix, but also 48% thought there needed to be more apartments available through the Housing Authority. And this was a question on what should the priorities be for people to be able to keep their own homes affordable and in good condition. And the most was to help residents access programs and funds to rehabilitate their homes. So that's a big one. Also 55% to help residents access programs, funds to assist with making their homes more accessible. So that's the program that Morgan will be talking about. So I am going to turn it over to Morgan to talk about these programs that I got off your website.
Sure. So I'm going to cover mostly the first two, but if anyone in the room is interested in the others or other programs that might be available regionally, I'm always happy to help. The first program on the list, the Housing Rehab Program, is mostly meant to help residents with code-based violations. So something like your roof leaking or falling in, a porch falling in, a stairway that might need to be rebuilt, or accessibility. So that could be adding a ramp onto the front of your home, putting in a step-in bathtub as opposed to one of the step-over bathtubs, that sort of work. And this work focuses on the southeast corner of town. This is an inset of the map of West Springfield. So the little dingle that comes off near Agawam and the river. We focus in this area, which is known as the Southeast Target Area. That is where we can census verify that a lot of the low to moderate income folks in town live. But we can do some of this work outside of the target area as well. This is run through the town through a grant from the federal government, and we run it with what we call a deferred payment loan. So we put a lien on the house for the amount of work that's done, but it requires no payments by the owner of the home. And that's just to kind of prevent people from flipping their houses after the work is done. So this is run through the town. I can help anyone with this. And then the second is the Home Modification Loan Program. This is not through the town. This is a state program, and it's facilitated by Wayfinders in Springfield. But this program is great because it provides a larger pool of funding than ours, you can get work done for, I think, up to 100,000. Whereas our one is under 50 for the most part. And this also requires no payments, but is repayable upon transfer of property. But this can be used for any sort of accessibility needs for any age. So some of the more creative uses I've seen, aside from the traditional accessibility, ramps, bathrooms, kitchens, this can also pay for perhaps an autistic child that needs a sensory room, or certain accessible school equipment in your home if your child lives at home, does school from home, that sort of thing. So this is more broad but accessibility based, and then the town's one is mostly focused on quality of life. But they're both available through the Community Development Office in Town Hall.
So, before we get started with the listening session, does anyone have any questions for Morgan or me? And I'd like to also hear from you about the Sisters of Mercy development too. But any questions for
So the Sisters Project is a 34-unit affordable housing. It's independent living, it's not assisted living. The expectation with the pools of money that were granted to the project is that folks moving in would be frail elders as defined by the state, so there would be people who are capable of independent living with assistance. But the assistance comes through the Mercy Life PACE program, not through staff within the housing program. So we're in the process of doing lease up now, and we have a wait list that's actually just a few people deep. So we're hopeful that we're going to take a little bit of the burden off of the housing authority for people who might be there in units that are not accessible, who might be appropriate to come over to the new construction, and hopefully that'll help shorten up their wait list as well. It's subsidized through the Mass Rental Voucher Program, so people who do live in the project will be spending their rent is capped at 35% of their income.
And is it mainly for seniors or just?
It's all seniors, 100%.
Okay.
And actually it was developed, so the town has supported the project in a number of ways. The Council on Aging and senior staff have been very involved in promoting it, both politically and then to potential applicants. The town did go through a 40B process, so we were an applicant that, because of the current zoning of the property, it would not have been able to have been developed as housing. So we actually successfully used the 40B process, a very friendly 40B, and then the Community Preservation Act program also provided development assistance of $750,000 towards the construction. It's just about a $10 million project, so that was a very significant commitment, and the project would not have gone forward without it.
And where's it located?
If you're using GPS, it'd be 2112 Riverdale Road, but the private way is 100 Hillside Circle.